Autism, Jamie Corker. What is autism? Autism, or autism spectrum disorder, refers to a range of conditions characterized by challenges with social skills, repetitive behaviors, speech and nonverbal communication, as well as by unique strengths and differences. We now know that there is not one autism, but many types, caused by different combinations of genetic and environmental influences. Facts about autism. The Centers for Disease Control and Prevention estimates autism's prevalences as 1 in 68 children in the United States. This includes 1 in 42 boys and 1 in 189 girls. An estimated 50,000 teens with autism become adults and lose school-based autism services each year. Around 1/3 of people with autism remain nonverbal. Around 1/3 of people with autism have an intellectual disability. Certain medical and mental health issues frequently accompany autism. They include gastrointestinal disorders, seizures, sleep disturbances, attention deficit and hyperactivity disorder, anxiety, and phobias. There are 3 different types of autism spectrum disorders. Autistic disorder. This is what most people think of when hearing the word autism. People with autistic disorder usually have significant language delays, social and communication challenges, and unusual behaviors and interests. Many people with autistic disorder also have intellectual disability. Asperger's syndrome. People with Asperger's syndrome usually have some milder symptoms of autistic disorder. They might have social challenges and unusual behaviors and interests. However, they typically do not have problems with language or intellectual disability. Pervasive developmental disorder. People who meet some of the criteria for autistic disorder or Asperger's syndrome, but not all, may be diagnosed with PDD-NOS. People with PDD-NOS usually have fewer and milder symptoms than those with autistic disorders. The symptoms might cause only social and communication challenges. Signs to look for in babies and toddlers include: by 6 months, no social smiles or other warm, joyful expressions directed at people. By 6 months, limited or no eye contact. By 9 months, no sharing of vocal sounds, smiles, or other nonverbal communications. By 12 months, no babbling. By 12 months, no use of gestures to communicate, such as pointing, reaching, waving. By 12 months, no response to name when called. By 16 months, no words. By 24 months, no meaningful 2-word phrases. Any loss of previously acquired speech, babbling, or social skills. Possible signs of autism at any age include avoiding eye contact and prefers to be alone, struggles with understanding other people's feelings, remains nonverbal or has delayed language development, repeats words or phrases over and over, gets upset by minor changes in routine or surroundings, has a highly restricted interest, performs repetitive behaviors such as flapping, rocking, or spinning, has unusual and often intense reactions to sounds, smells, tastes, textures, lights, and/or colors. Autism is diagnosed in 2 different ways, in 2 different stages. First, one has a developmental screening. This includes comprehensive diagnostic evaluation, and it also is a test to tell if children are learning basic skills when they should or if they might have delays. The other is a comprehensive diagnostic evaluation. This thorough review may include looking at the child's behavior and development and interviewing the parents. It may also include a hearing and vision screening, genetic testing, neurological testing, and other medical testing. Some of the ways autism affects family. Emotional impacts such as embarrassment or feeling left out of social engagements. There are different ways autism affects family. Emotional impacts such as embarrassment or feeling left out of social engagements. Marital impact. The affected child causes the parents to disagree on things such as treatment and cost. Sibling impact. Primarily the sibling being ignored because of the attention the affected family member receives. Financial impact. The cost of care for the affected family member. Autism instructional strategies. Discrete trial teaching, floor time or difference relationship model, picture exchange communication system, pivotal response treatment, relationship development intervention, social communication, training and education of autistic and related handicapped children, verbal behavior. Educational outcomes of students with autism. With the advancement of technology, higher education is available to adolescents and adults on autism spectrum. Technology permits accommodations to be built directly into the lesson. Online classrooms are available in multiple formats to fit the learner's needs. Visual learners are able to read the information, while auditory learners can listen to it. Anyone can access content multiple times as needed. Assessments are also offered in multiple formats. Autism technology. Modern technology is also extremely engaging for students with autism. Many autistic individuals find socialization is easier and more pleasant when conducted online, via text, or even simply around the presence of technology.